Oshawa.
Thank you very much, Madam Speaker, and I'm very pleased to be able to rise and have the opportunity. Only 6 minutes, never enough time when we are talking about something so important as recognizing service and the supports needed. And I appreciate this bill, which is the PTSD Awareness Day Act, and I appreciate the member bringing it forward and his service to his own community. I think it's very important to have a bill like this that does indeed aim to bring awareness. We have spent many hours in this chamber debating and discussing our first responders and talking about post-traumatic stress disorder, but to have a day where the rest of the province can have a better understanding, can learn more about this, I think is only going to serve those who struggle with PTSD and mental illness, going to serve them better. So I think that something like this to bring awareness helps to destigmatize, helps to challenge the culture of a lack of acceptance. One of the very first meetings that I had over 4 years ago in my office was a veteran who came to me and wanted me to have a better understanding of PTSD. And I knew about it academically, but to have a gentleman sitting in front of me bringing this to me, and he explained it that he felt like a broken teapot, that while through the years he's been able, fortunately, to get the help that he needed to put those pieces back together and re-glue that teapot, so to speak, so that it could, again, function and do what it was supposed to do, but you will always see the cracks. And that was how he explained it to me. And then I was struck by a conversation I had recently with a female veteran who came to me, and she said in her own journey, she didn't see the broken teapot. She was putting her life back together as a new mosaic with those pieces and creating something new. But each individual on this journey needs the support by the professionals that we need across our communities that unfortunately we don't have the way we need. We do need to always take the opportunity to invest in understanding, but in mental health and the supports and services. One of the things that came up with the presumption that we brought forward, the presumptive legislation, so that our first responders no longer had to prove and re-traumatize themselves with WSIB to get coverage for PTSD. And I would encourage this government to take a look at some of the legislation that was brought forward towards the end of session that didn't make it through committee. My colleague from Essex and Bill 151, and that was adding more folks under that umbrella of the presumption. So let's do that. But one of the things that came out was for people to even get that diagnosis. The new legislation says that it has to be under DSM-5. Well, the short version is that DSM-5 diagnosis for PTSD means that it must be done by a psychologist or psychiatrist, no longer a medical doctor. Well, that is a real challenge for our friends up north and in rural communities who don't have access to that same psychological support and service. So that's an unintended challenge, but it's something we have to be talking about this. So I'm not going to tell all of the stories of the individuals that we have met in our communities. I know that we all have. I want to thank our first responders. I want to thank everyone who struggles with PTSD. And I'm very glad to see in the text of this bill that it does say PTSD can affect anyone, regardless of socioeconomic status, gender, age, nationality, or vocation, because trauma can happen everywhere, and we need to support it when we have the opportunity. It's so hard not to tell individual stories here, but I know that that's what will come from having an awareness day, that across our communities, people will have a better understanding of the challenges and the struggles. Our police officers, I had a gentleman come, and he's a Greater Toronto area officer, and he went back to work. He was off work with PTSD, and he went back before he was ready. Partly because of financial pressures, partly because of the desire to be a part of, policing is a community, and he went back early, and unfortunately that exacerbated his PTSD and has had very, very challenging consequences. And we know that we want all of our first responders, whether they be our correctional officers, our firefighters, our nurses, our police officers, our military folks, we want all of them to be healthy. Their families want them to be healthy. They want to be healthy. Our community needs them to be healthy. So while we bring awareness and we we talk about it. We have to, in tandem, be ensuring that those services are accessible, that they are there every day. You know, we will all be attending in the fall. We will all be at our Remembrance Day ceremonies, and it's a very solemn and important day that brings a broader understanding. But what I've learned from some of our veterans, that it is so challenging for them to maybe even leave the house on that day. And so how do we support them every other day as well? And that has to be part of what comes from an awareness day like this, but the conversations on an ongoing basis. We need people to have that support everywhere they turn, in our hospitals, but our mental health needs to be a significant focus, and we have to invest in that. So I congratulate the member. We're very pleased to support this. Thank you, Madam Speaker.